for the first time in this new Trump administration, pieces of his administration are really pushing back. Elon Musk's demand that all federal employees justify their jobs in 5 bullet points or else is facing pushback from within. Some of Trump's own agency heads are telling their employees to not respond, including leaders at HHS, an agency that's already been hit very hard by mass layoffs. More than 700 people at the CDC fired. More than 700 people at the FDA fired. More than 1,100 people at NIH also fired. All at the hands of the Trump administration and facing a brutal seasonal flu season, serious measles outbreaks, and the ongoing bird flu outbreak. The USDA has actually been left to scrambling itself to rescind some of the firings, now trying to get back on the job. Experts central to the nation's efforts to contain the bird flu crisis. Joining us right now is the man who most recently was leading the FDA, former FDA Commissioner, Dr. Robert Califf. Doctor, it's good to see you. Thank you so much for coming in. One public health expert warned that these staff cuts that I just laid out in kind of broad strokes could have deadly consequences. So far at the FDA, as I mentioned, it's north of 700. What does that look like at the FDA you just departed?
Well, Kate, it's good to be with you, but this is a really serious issue that we're dealing with. The FDA regulates 20% of the economy, including the vital drugs, devices, safety of food. And this is a fast-moving set of industries that we're regulating with a lot of new science. So this across-the-board cut of employees that had just been there for less than 2 years or had been promoted within the last 2 years is really not a very good way to do this, because you're getting rid of the people who were just hired to take care of our most vital areas of risk. You know, I'll just give an example that's concerning me today. Last night, I got an email from a parent of a child with rare disease. The NIH FDA Rare Disease Day was supposed to be Thursday and Friday, a joint meeting. This is an area where, because of gene editing, these children who had no hope of surviving now have hope. But it's very dependent on the FDA, the NIH, and the industries working together to solve the problems, because this is not child's play. When you edit the genome of a human being, most of the time it doesn't work and things go wrong. So you have to have a system in place to take care of it. So here these parents are asking me to come speak to them, even though I'm no longer in the job, because no one from FDA or NIH can be there. Just one example.
But one example is a family story, and that just shows that is just a small piece of what so many more people could be facing. I mean, do you think there are 700 positions that can be cut from FDA and not have a negative impact?
Well, I'm certainly willing to engage in the discussion with anyone, but my experience, you know, I've worked in biotech, big tech. I worked at Alphabet for a while, academic medical centers, healthcare systems. The FDA is stretched to the limit. Every segment of FDA is authorized by Congress to deal with an issue which is of public health importance to the American people. So I don't see 700 across the board as being in any way a reasonable approach to this problem. It reminds me of startups in Silicon Valley where I worked. That's a whole different situation, though. When things go through the laps here, people can be killed or hurt very seriously. So no, I don't see 700 jobs, but you know, before doing things, let's have a plan and have the arguments and discussions and involve the Congress, which after all, put the FDA budget in place. I'd also point out that half the FDA budget is user fees from the regulated industries who have agreed to pay for this because they need competent reviewers to make sure that the products that they're producing are safe and effective, and that the inspections that are going on all over the world in global supply chains are good inspections by people who know what they're doing. Just think about the things that you use every day, or if you have a relative who's on a medication. Imagine that we're not able to get the inspections done all around the world in a reasonable period of time. This is serious stuff.
Broadly speaking, as there are becoming examples of the Robert F. Kennedy Jr., who's now the head of HHS, him taking actions like postponing indefinitely ACIP meetings that were supposed to happen today, talking about wanting to tackle as a priority, investigating the childhood vaccine schedule. Things are happening. The rhetoric is being put into action. Broadly speaking, though, for the Elon Musks, the RFK Juniors, the people who think that the federal government is bloated and rife with waste, what do you want them to understand about just the FDA, the agency that you ran when it comes to this?
Well, I can speak, obviously most concretely about the FDA, although the whole federal government I know has similar issues. I think, imagine that RFK now encounters an outbreak of salmonella in lettuce. If there's not somebody there who actually knows how farms work and how the regulations work and how to get the recalls done, this is going to be catastrophic with people either dead or disabled because of this problem. H5N1 is a huge risk right now, the bird flu. And the Center for Veterinary Medicine was gutted in this, which people don't think about often. That's part of FDA also. And it's interesting. Americans care a lot about their pets and the food that they eat. But of course, with cattle and chickens, you've been talking about the price of eggs today. That's not some happenstance. That's because birds are dying from bird flu. At the same time, the people that work on this at the FDA are being downsized. This makes no sense. And of course, we're all concerned about the measles outbreak and the risk to children of not being vaccinated in this time. And I'm really worried that the promises made in the confirmation hearing are already not being kept. I would hope that we hold people accountable. And finally, I'd say when you look at Mr. Musk and his team, the FDA deals with a lot of confidential information, protecting individuals who are subjects in human clinical trials, really experiments done to evaluate drugs and devices, and the trade secrets of companies. We're really proud at FDA that we've managed those trade secrets incredibly well, under assault every day from China and others trying to get into our information systems. It doesn't sound to me like the conflicts of interest are being handled at all across the board. So I'm really worried about the corruption of people who have vested interest in outcomes like Mr. Musk's companies invading the regulatory system and commandeering it. This is something that just shouldn't be allowed.
Dr. Robert Califf, former FDA commissioner, thank you for coming in.